Ding.
Welcome to the Grappling With podcast. Dr. Chris Hardy and William Walker will take a deep dive into topics covering wellness and prevention, performance, recovery, and injury management. Our mission is to provide the latest science-based information to help you get the most out of your grappling journey, both on and off the mats, and help you overcome any challenges you may be grappling with. Dr. Hardy is a licensed physician and BJJ practitioner, but the contents of the podcast are meant for educational purposes only and should not be taken as medical advice. Please seek out personalized care from your own medical provider prior to implementing any medical treatment or intervention.
That's someone else.
Well, how are you doing?
I'm
Is your levels okay over there, buddy?
My headphones are a little hot.
Can everyone hear?
Yeah, we can hear.
We can hear fine. Okay, who's hot?
You just blew me. Okay, that's too loud.
That's you then. You're
Yeah, you turned me off.
Is that better?
Give me right in the middle.
Yeah.
You were right in the middle.
How about just a little below middle?
Okay. Right there?
Yeah.
Is that good? Does that work?
That's fine.
Nice.
So Olivia actually blew you, just for everyone to be clear.
Right after Chris's voice.
Oh, right. But it didn't take long, Carrie.
It didn't.
That did not take long.
Well, he started it.
So we have a doozy of an episode today.
A deuce.
A doozy.
Look at you.
She's on today, man. She's on fire.
Yeah.
We're going to talk about gut health. And people are like, why are we listening to this related to jiu-jitsu? Why are we? Because I will tie this in at the end to how it might affect athletic performance, certainly affects your overall health. So, Carrie, what I thought we would do, because it's pretty complex, Carrie's going to give us an overview with me kind of interjecting here and there, and then I'll kind of pull in some stuff, pull it together for some things that may be related to athletic performance, and then we'll talk about things you can do to maybe help if you're having problems with this. Yep. So, Carrie, sorry. Those of you that haven't seen my wife here, she is a physician, does integrative medicine, functional medicine, and is really good with gut health and GI health. So, take it away.
So we always need to start off by checking the poo.
Yes.
It's one of our favorite lines from
Scrubs,
right?
Yes.
And they had a whole song about checking the poo, so it fits today. So we're checking the poo.
Do you guys watch it? Like, you guys like Scrubs?
Yeah.
Oh, yeah.
How about Grey's Anatomy?
No.
Never seen it.
Okay.
No,
Never.
Scrubs actually, although it was funny, Scrubs actually gets the medical stuff correct.
Yes.
Oh, okay.
Whereas some of those serious doctor shows are completely off the mark. Yeah, ER was pretty good sometimes.
Okay.
Sometimes.
Scrubs was actually right on. It's pretty funny.
Yeah.
So
Funny.
yeah. So anyway.
So gut health.
Yes.
So gut health actually goes all the way back to the time of Hippocrates, where he thought all ailments came from the GI system. And it wasn't really until Leeuwenhoek, so back when Chris was a child, he and Leeuwenhoek were playing around and discovered that when they pooped in something and then could look under it in a microscope, they could see animalcules.
You're older than me, woman.
Oh,
Since she went ages first.
Okay.
Your voice is trembling.
It is trembling. I'm a
I feel
little,
like you immediately regretted that.
I'm a little scared.
It cracked. You're older than me, woman?
I know.
Yes, I am, and now I'm going to whip your ass a little bit later.
Hey, my day's looking up.
Okay.
So,
But anyway, so Leeuwenhoek was the inventor of the microscope and also took a look at, was the first one to start to identify things under the microscope, but he called them animalcules. Now we call them microbiome or microbiota, or they're viruses, parasites, etc. So when we're talking about the gut microbiome, we're talking about everything from the mouth all the way down to the anus. That's your butt. And there's different species everywhere that we go. People think about only, when they talk about the gut microbiome, they think only about the large intestines, but we have bacteria in our mouth, and there should be a healthy population in there. Areas that were thought to be more sterile, like the small intestines has their own gut microbiome. And then there's species that also live in the stomach, and then, of course, the large intestines. But when we think about the gut microbiome, people always simplify it too much. Like they call it good or bad, right? So early on when they were trying to figure out what was causing ulcers in the stomach, they're like, oh, it's H. pylori, when they finally figured that out. And so they try to eradicate it. Well, it's necessary, but it's necessary in the right amount. Just like Chris's humor is necessary in the right amount.
Very small amounts,
Yeah.
Yes.
but
necessary.
necessary.
Well,
Yeah.
let me interject a little bit with some nomenclature, some naming.
big brain.
So when we talk about microbiome, and other people say microbiota, it's actually different. So microbiota is the actual species of bacteria, fungi, whatever's inhabiting the gastrointestinal tract. The microbiome is the collection of genes that encompasses. For instance, if let's say we had a bunch of rats, and let's say this isn't true, but let's just say there's 100 different species of them, okay? That would be the rat biota, the species. But let's say some of them have blue eyes. That would be the rat, like Bill. So that's a gene in some, but not all the species. But when we talk about the biome, we're talking about the collection of genes. So it would be like the collection of blue eyes, right? Which could be several species. So it's really important we get that nomenclature right, because we'll hear microbiome, which is actually more important clinically, the collection of genes all those species together encompass, versus microbiota, which is the actual species themselves, if that makes sense. Okay.
Yep. And so we just want to make sure that all of it is necessary. They just need to make sure that they're in the right populations, right quantities for overall health. And there's things like Chris recommended, and we'll talk about those at the very end, how we can enhance those or do what we can to alter them to make sure that they are in a good population to serve us well. The gut microbiome as a general we're actually more microbial species than we are ourselves, because there's trillions of microbiome of different species within the gut microbiome, and their DNA is also more numerous. So we really are in a symbiotic relationship with each other. When we're born, that's where we get our first exposure to the microbiome, coming through the birth canal, getting those species out of the vagina as we're coming through. For those children that are born via C-section, there's some very forward-thinking doctors now that are taking a sterile gauze during surgery, putting it in the vagina, and then when babies are coming out via C-section, putting it in the baby's mouth to start to get some of that biome.
Okay.
The overall gut microbiome doesn't mature until you're about 3 years old, and is quite variable. It has a great turnover during those first 3 years of life.
What about like someone that's like a preemie, like Chris?
No, he was just small for his age.
Oh, I thought he was like 3 months premature.
No, I was a fat baby, actually.
Really?
I was like 9 pounds, 6 ounces or something like that.
You got a preemie look to you, so
I have an FLK look. You know what that is?
no.
Funny looking kid.
Actually, you don't.
Yeah.
If you've ever seen them, that's
Yeah.
very distinct. Yeah.
Yeah.
But anyway, so
FLOM? FL, funny
Yeah.
looking old man.
Fair enough.
So there's things that we can even do at that early age. So for my moms that come in, if they've had a C-section, we have them give just a little bit of probiotic early on, and I have them do it for the first 2 years of life. But research is probably showing that we should go a little bit further out with that.
Well, the reason why, what the research has shown is babies born to C-section will have a higher incidence of autoimmune disease later in life. And the reason why is if you have a good, diverse microbiome or microbiota as a child, it helps train your immune system.
Is that a pretty large percentage?
It's becoming more and more of a higher percentage, right? And if you've looked at the epidemiology of autoimmune disease, it seems to be increasing anyway. And Carrie's going to go over one of the biggest functions of the microbiota is to train our immune system as we're coming up in infancy and certainly as in the toddler age. If you don't have that initial inoculation early on through vaginal birth, it's not as diverse or numerous. And then their immune systems tend to be more reactive, and we're seeing more and more of this. And we'll talk about other causes of that as well. You see some parents that are very germaphobe and try to keep their kids in a sterile environment. Mm-hmm. They're doing their kids a disservice too, as far as their immune system. So kids should be out playing in dirt,
Eating a little dirt, all of those things.
I mean, it helps.
Kiss the puppies, those kinds of things.
Right.
Yeah.
Interesting.
Yeah.
They're also showing that even if the children are still born vaginally, like of course they get that initial inoculation, but then if for some reason the mom can't breastfeed, or for those that elect not to breastfeed, although that's becoming less and less, those children also are having diseases later on in life that they think is connected to a decrease in the gut microbiome, because even just suckling on the breast is getting some of that natural skin microbiome that then can help inoculate the GI system as well. Yeah. So, and let's see, what else do we want to, we talked about that. We're really going to get more into nutrition, about how nutrition impacts the gut microbiome, but this is also how our gut microbiome is impacted overall. Our biggest interaction with our environment is through our food. And so different foods can create different changes within the gut microbiome. And we actually learned a few things from a different podcast we were listening to over the weekend, how some of that may be changing. And I think you took a little look at some of that stuff as well.
Yeah, I did.
Yeah.
Well, also just very quickly, we really have to think about this, the gut microbiota, as an organ system, just as important as the liver and other things for health. And that's going to be very, very important as we go forward, especially as we do things in our modern environment that disrupt it substantially. So Carrie's going to, I'm sure, touch on that stuff a bit.
Yeah, we sure will. And so I guess our next place really is to kind of talk about a little bit of gut dysbiosis. And some people may not even know they have gut dysbiosis. So often when we have a little dysbiosis, people automatically think of those irritable bowel syndromes where they're just having voluminous diarrhea. But that's not always the case.
Yeah, let's talk about dysbiosis. What that
I was going to
means.
say, what does that word mean?
Yeah. We'll talk about that in just a moment. But you can start to get an idea if there's a dysfunction going on in your GI system by looking at your stool. So even though we were being a little jokey early on, we want to make sure that our stools are looking pretty normal.
When you say stools.
Your poop.
Oh.
We're talking about your shit.
Not IKEA.
No, not the
Stools.
IKEA stools. Not something you're going to get off Amazon.
Dookie.
Your Dookie. You're number 2.
You want to hear a funny story?
I do.
Not to interrupt, but if I could interject with
Please.
some nomenclature.
Oh my gosh.
So I used to be a heathen, and I had friends that were also heathens.
Used to be.
Used to be.
Yes, I'm a clean
hold
angel
on.
now.
Is this a shower?
No.
Okay.
That's another poop story we can talk about.
That was gross.
So that same fella was with me on this, though. So
Is this Aurelius
Surprised me.
again?
no,
Okay.
no, I will not put
Aurelius
his
is
name
a
through the
clean.
dirt.
It is his birthday though, so shout out.
It is.
Yeah, it's Aurelius'
Aurelio's
birthday.
Yeah.
Call him Aurelio when he's not around.
Oh, okay. He really likes that.
He loves it when his mom calls him that. we would call his house, and his mom could barely speak English at the time, and we would just hear her yell for him, Aurelio, Aurelio, and we were like, "What the hell is she saying?" It was amazing. So then, as friends do, we call him Aurelio to his face. He didn't like it.
Okay.
So, anyways, poop. We were running around. This is probably, I want to say like maybe 8th grade or something like that. I would take my mom's car. Well,
Did you
not
say
my
8th
mom's
grade?
car. Yeah.
Okay.
Maybe freshman year. I don't know. My mom's going to be listening to this, so
Yeah.
I apologize, Mom. I just realized that. So, anyways, we were running around, and you egging people's houses, all the people that you know where they live and stuff like that. Well, my horrible friends decided to poop in the egg carton box. Fill that sucker up like a chili cheese dog.
By the way,
Safe
only
go.
dudes would do this.
Yeah, especially because there was one dude holding the
Oh,
thing for him, like to
couldn't
make.
put it on the ground.
Nice.
He could have put it on the ground, but he did not. He just wanted to help in the situation. Excuse me. And once he had filled the receptacle, the egg carton, they found a card to put it on the windshield.
Oh,
It spread a lot.
I bet.
It was rude, disrespectful, and I'm not proud of it.
were you the one who pooped in the egg carton?
I was not. I was the driver.
I would say, were you holding the carton?
I volunteered, but someone beat me in rock, paper, scissors for it.
Oh, man.
The fact that you were willing to hold the carton instead of, like Olivia said, just put it on the ground.
Not willing.
Okay.
I wanted.
Carrie,
Okay.
these are young males, and speaking as a male, I can tell you there was not that type of thought going on.
No.
We're like, yes, no, we're going to hold this.
Yeah. You didn't want the lid to come like the
Yeah.
wind of,
Yeah.
the wind might blow it when it's sitting on the ground. Then you lose all that poo.
Yeah, it's very efficient.
Yeah.
So this was your first kind of foray into like visually looking at other people's poo.
Yeah. This is my first time examining another man's poo coming out of his butt.
Okay.
So, as we're talking about the character of poo in general,
Yes.
so there's a really great little chart. It's called the Bristol stool chart. I finally got it in color so that when I talk to kids about their poo, they think it's funny. They
Yeah.
laugh and they look at it and then they'll point.
It's poo.
Yeah,
Why couldn't I have had a doctor like you when I was a kid?
I don't know. But so there's like 7 grades of stool. The first being like bunny turds. So something wrong, small, round, and hard, kind of like your head. And then
Milk duds.
Milk duds. Then there's like grapes, like where they're all clustered together, hard round poos.
Okay.
So neither of those two are good.
Okay. So if you
When-
see those are bad.
When we start to get something like this, like Bill's delicious little payday,
Hold that up
that's
to so she can see.
starting to look a bit more normal, but you can see we've got some lumpies in
Someone
there.
had some nuts.
Someone did have some nuts. Here, have some poo. There you go. Good boy. And then
That's some good poo.
there we go. And then it starts to look more sausage-like. Sausage is normal. Paydays, mostly normal.
Okay.
Cow pies, not normal.
What was that?
Cow pies, soft and kind of like soft serve ice cream. Not good.
Okay.
Soft serve ice cream that is starting to fragment. Not good. And then water out your butt. Very bad.
So the fragment, is that more like the explosive? Like
Yeah.
it's very soft, but it's like
Yep.
okay.
Splattering the bowl.
Confetti
Yeah.
butt.
Confetti butt. Yeah. There we go.
Throwback.
And so 1 and 2, bad. And then 5, 6, and 7, bad. So we have some sort of dysbiosis going on. And what dysbiosis means is that we don't have the right amount of bacteria, not just bacteria, of the microbiome in the right species to facilitate proper digestion and formulation of stool.
Most, when you think about what we call a health-associated microbiota, it typically is very diverse in species. It's like going to a zoo with a ton of different types of animals, as opposed to showing up and like, hey man, we got elephants and zebras. That's it.
Yeah.
So in dysbiosis means there's typically an imbalance where hey, the zebras have gotten out of control and we've got a whole bunch of those and not a bunch of anything else.
Yeah.
What is so when you're identifying where you're at, is there a direct link? Like if you see 1 and 2, which would be your rabbits and your grapes, right? That means this. That indicates this.
Not necessarily.
Okay.
Not necessarily. They're doing the best they can to try to figure some of this out. The problem with they have a good general idea of what a healthy gut microbiome should look like. However, one, they do try to culture the stool to get an idea of what's going on there. They look at a few other things like how much fat or fiber or other particles are coming out with that stool. But most of these species are still kind of uncharacterized because we don't have the technology to culture them well. So
it's getting better. There's
It
some
is.
there's some genomic analysis now we call shotgun metagenomics, where we can take a sample of poo and we can at once basically kind of sequence all the genes from it to get an idea of the diversity of it. So
How are you capturing that poo?
So that's a really great question. So we actually
you.
have these little plastic cutout things that sit across your toilet, and then there's a Cool Whip container that goes into it, and then you get to spoon your poo out and put it into little sterile containers that go to the lab.
Where does the Cool Whip container come in?
So it sits in that cutout. So then you, instead of putting the egg carton under your butt, you're putting the Cool Whip container under your butt.
One of those like tub, kind
Yeah.
of mini tub. Okay.
Yeah.
I was thinking the spray bottle.
Oh, no.
That's where I was a little
The good Cool Whip
oh yeah,
out
that's
of the
true.
freezer aisle,
Right.
not the cheap shit.
Offensive. Yeah. Okay. Okay.
Yeah.
So, and then that person, they package up their little present, bring it to you.
Yeah. Do not return the stool container. I do not want it.
Okay.
Yeah.
Okay.
Yeah.
Good things.
Good things. And so that dysbiosis can occur, again, anywhere along the line and cause issues. Normally, if we're having like stomach issues, it's treated a little differently. And I'm going to put a caveat on that because I kind of still add in a common component regardless of where the dysbiosis is. One of the things that's become more popular as far as dysbiosis goes is that small intestinal bowel overgrowth, or SIBO. And there are some pretty decent tests for that. They do breath tests where they check they have you drink the sugary solution and then they check your breath for methane or hydrogen. And that gives them an idea about but that's just in the small intestines. The large intestines is still a little bit more difficult to figure out.
To put that in context, as you go through the GI tract, the small intestines don't have near the amount of bacteria that the large intestines do because they serve a very different purpose, where the small intestine is where we absorb anywhere from 60 to 90% of all our nutrients. Okay. And so then the large intestine, anything that's not absorbed in the small intestine goes to the large intestine with those, which has trillions of microbiota in the large intestine. So what she's saying is sometimes you have an overgrowth, like the large intestine, the large intestine neighborhood is starting to encroach up the small intestine. And it can cause all kinds of absorption problems and not getting, you're not getting the right peristalsis, like the movement of food. So that's when she talks about SIBO, or small intestinal bacterial overgrowth. That means it's coming up and really colonizing places it shouldn't be colonizing.
I see.
And unfortunately, we still have some specialists within the gastrointestinal field that don't buy into it, and they think it's all just kind of bunk. But this dysbiosis can cause a lot of different diseases, and we're going to go over a few of those in just a moment. Another thing that occurs is, so if we think about the GI system and the cells, that lining should be pretty patent. So it allows enough for some small molecules to go through, but then it can start to get disrupted, and we start to look like, instead of a bowl that's pretty patent, we start to look like a colander where things can fall through. One of those things that fall through, and that's really been well studied, is by Dr. Alessio Fasano, zonulin. And zonulin, they're finding, is becoming a bigger and bigger problem when, as a protein, it's found out in other areas to contribute to overall poor health. And so dysbiosis, things that are associated with dysbiosis, and I'm going to do the Chris and put on the nerd glasses so that I can actually see.
Turning Chris on.
We've already rubbed one out earlier. He's good for another 10 minutes.
Oh my gosh.
So things like aging early
Yeah.
are an issue, and that's caused by some dysbiosis and diseases associated with zonulin specifically. An autoimmune disease called ankylosing spondylitis.
Okay. You're making words up now.
Nope, actually a thing. ADHD, they're contributing to zonulin and gut dysbiosis, and
Okay. Zonulin.
zonulin is a protein. Zonulin is a protein that helps keep these cells tight together.
It sounds like a Star Trek character,
It's not.
like a Romulan.
It's not.
So some way to think about this is
protein.
It's a protein.
what Carrie is saying is, a lot of people don't realize that 70 to 80% of our immune system is below those borders of the gut. So food comes in and they have cells that line the tube of the gut, right?
Okay.
The intestines, they have cells there. They selectively allow things in and out, but they have these things called tight junctions, is what she's talking about, that the cells themselves are stuck together, almost like a row house. Have you seen row houses where they're all just townhouses or just kind of just stuck together?
Yeah.
Imagine those townhouses are pulled apart. They're one of the proteins that holds them, kind of helps hold those junctions together, is zonulin. And sometimes there's things that we'll talk about here soon that will disrupt that barrier. So the townhouses get pulled apart, and instead of going through the doors of the townhouses where people can actually determine who is going to come in and out, they just rip right through this new alleyway that's formed without any kind of checks and balances. And on the other side, in the backyards of these row of townhouses, is the immune system waiting to kind of like, hey, we got some invaders.
And then
coming
stuff
through.
gets out of whack. And
It does, and that's why you're seeing things that it promotes inflammation and all these diseases she's talking about. Many of them are autoimmune, where the immune system gets so fired up it starts attacking our own cells, and you see them all throughout the body, and it starts there in the gut.
Yeah.
Okay.
And it starts because there's actually a dysbiosis. So we don't have the right gatekeepers keeping those row houses together. We have different bad characters that are pooping in egg cartons and leaving them on cars and just allowing things to run amok. And so other diseases that are associated with this, so ADHD, actually that entire autism spectrum, which ADHD is at one end here, autism is at the other. They're thinking that is what's going on there. And obviously the irritable bowel syndromes, the colitis, Crohn's disease, they think chronic fatigue, maybe even fibromyalgia, even though it's not on this list, gestational diabetes or diabetes that's associated during pregnancy, insulin resistance, hyperlipidemia, depression and anxiety, multiple sclerosis, which is also an autoimmune disorder, non-alcoholic fatty liver, which I thought was really interesting, and then both type 1 and type 2 diabetes. That's just a short list of things. They also are thinking that the dysbiosis, not necessarily zonulin particularly, is also contributing to things like Alzheimer's, dementias, Parkinson's disease, ALS. So there's a whole host of things that they're now starting to associate with a dysbiosis.
And people may be asking, well, how the heck is stuff down here in the gut causing brain problems, right?
Right.
Well, another key portion of this anatomy is the gut is innervated by the vagus nerve. We've talked about this a bunch in other episodes, right? It's like a 2-lane highway from the brain down to the gut, and it communicates both ways. That's why when you're nervous or anxious, people can have problems with their bowels, diarrhea. And vice versa, when there's inflammation going on down there, it promotes inflammation in the brain as well too.
So if someone's like just kind of riddled with anxiety or stress, they could have GI distress
and vice versa. And it's a chicken or the egg thing. It's like, well, a lot of this stuff is caused by, and when we talk about these townhouses being the barriers being disrupted, that's generally called intestinal permeability. A lot of people in the lay world call it leaky gut. You may have heard someone talk about that. Intestinal permeability is something that does happen in short duration as part of the natural function of the gut, but there are things that disrupt it for long periods of time, leading to things that should not be hitting the immune system, hitting it hard, and then communicating this inflammation up to the brain and causing, it's not just the brain, but that's why you see all these neuro disorders she's reading out. And like how's anxiety and depression? Because it puts the brain in a flight or fight response.
So I kind of already asked, but this deficiency, the stress, that cycle, are you going to be able to identify that with how your stool looks, or not necessarily?
Not necessarily.
Okay.
Now, often people with the anxiety piece, I think they do more often have like gas or bloating, or they have some sort of GI symptoms that are associated with it. The other piece about that whole gut-brain connection, and it's really, again, becoming better understood and better accepted within the common medical community, is that vagus nerve. So we have 12 cranial nerves that come directly off of the brain. Cranial nerve number 10, the vagus nerve, comes down and supplies the heart, the lungs, and the GI system. And so when we have those inflammatory particles, that's like a little 2-lane highway. So it can go directly up to those other places. And so dysbiosis can also cause things like cardiovascular disease, obesity, and we'll talk a little bit about obesity because you have an interesting little case study.
Yeah, actually, we have a very interesting thing. Well, so people also forget that there's as many neurons or nerve cells in the gut as there are in the spinal cord.
It has its own nervous system.
It's called the enteric nervous system. That's why it's called the second brain by a lot of folks. So it's very, very interesting. As a matter of fact, most of the serotonin that people associate with depression and all that, which has recently kind of been disproven, but most of the serotonin produced in the body is produced down in the gut too.
Yeah.
So kind of interesting.
And then another little interesting piece where people are like, oh, I'm taking all this melatonin. Like, well, the GI system has the most receptors, especially the large intestines, for melatonin. So if melatonin isn't working for you, then maybe you still have some gut dysbiosis going on. And of course, all those supplements are way too hot for people to be taking. Like, it's more than we ever make at one time.
Right.
But there's things within the gut that people don't really understand because medicine in general has done such a good job to become so compartmentalized that we're taking the whole person out of these individual things.
Yeah, absolutely.
And so then the next question would be, well, what's causing some of this gut dysbiosis? And everyone already can probably guess the very first one, which is oral antibiotics. Frequent oral antibiotic use can cause a huge gut dysbiosis. Food poisoning, where you're getting a very pathogenic species or something that's going to cause disease, can cause a lot of havoc with the gut dysbiosis. NSAIDs, and Chris is going to talk a little bit more about NSAIDs, or things like Tylenol, ibuprofen, even some of the prescription ones for like chronic arthritis, which also is a gut dysbiosis issue.
You said chronic arthritis?
People that are taking
NSAIDs for to relieve like arthritis in general.
She mentioned Tylenol. Obviously, Tylenol is not an NSAID, but it can also cause problems with the gut. But the things like ibuprofen and naproxen that people with conditions like arthritis, they take all the time. can cause severe problems with how the gut works, and we'll talk about that in a minute.
And chronic PPI use.
Oh.
The like the Pepcid, et cetera, those things to control heartburn. That's really horrible, actually, long-term use.
Yeah,
There's a time it
Protonics, Prevacid, all those. She said PPI, proton pump inhibitors, that are only meant to be used for. You can even read the package insert that says you should only be using it for a couple weeks at most. Doctors are having people on them for years,
decades,
causing huge problems with their digestive.
Is that
tract.
kind of like what are those things that fizz when you drop in them?
No.
That's not what those are.
No.
The Alka-Seltzer? What are
Yeah, it's
Yeah.
that's a little different.
Okay.
These are things like, you've heard the advertisements for Nexium, so-called the purple pill. You may have heard all that. Prevacid, all these proton pump inhibitors.
Prilosec?
Prilosec's
Yep.
another one. But these things are not meant to be used for long periods of time. Basically, they prevent stomach acid from forming, and stomach acid is absolutely essential. So we're treating a symptom and not the underlying cause of the problem.
Which, what's funny is I know my mom had told me this, but I think I'd heard it somewhere else because I worked for a GI clinic. And I remember being told by someone, I'm not quite sure, but I don't want to say it was necessarily the clinic, but that this was the PPIs or Prilosec and stuff like that are the most studied medication out there, and it's been proven that it's safe.
That's changing. So
Yeah.
as they start to understand more about the gut microbiome overall, they are realizing how bad these things are.
Yeah.
But it's still pretty much mainstay as far as like treatment, like, oh, you've got heartburn or
Yeah.
GERD or
Well,
indigestion, you're just going to get these
it's the
CPIs.
15-minute medical appointment. Oh, I got heartburn. They're like, oh, here's a
Here's your sample from
Yeah, right. And that's a whole discussion in itself about proton pump inhibitors. But so also when she mentioned antibiotic use, especially frequent antibiotic use in children, as their microbiome is developing, is a huge problem. People that go in and say, they have a cold and congestion, they go in and demand a Z-Pack or something like that, like every time they get that. Not only does that contribute to antibiotic resistance among these bacteria, creating like these superbugs, but it's also wreaking havoc on their microbiome. And because this is kind of a black box and it's kind of, you don't really see because it's inside, they don't really realize what it's doing. And a lot of people, until they start feeling better, don't realize how bad they were feeling.
Yeah, exactly. Some people think, oh, I'm doing pretty good. All right.
Mm-hmm.
And then you just start to help layer some foundational things in for them. And next thing you know, they're like, oh, okay, I actually do feel better. So,
And we'll talk about why that is here in a minute.
yeah. So I think we have a pretty good foundation for what the gut is overall, which, again, starts, like we really have to think about mouth health, and we haven't really even talked about that. But it starts, the stomach, the small intestines, the large intestines, and that dysbiosis can occur anywhere through there. And so now most of our listeners are going to want to hear, like, well, what does this have to do with me doing jujitsu? So,
Yeah, well, we'll talk a very, very, that's been kind of a topical subject is what happened to Gordon Ryan. If anybody listened to what he was just on Rogan, talking about his experience, and he basically had staph, for staph infections, recurrent staph infections. And he just divulged he basically was on antibiotics for a year, more often than he was not on them.
Yeah.
Basically, just destroyed his microbiota.
It was essentially every month he had an outbreak, or every other month.
Yeah, and because of that, of course, and he had to be treated, right, because of staph. But then what happened to his gut? He was misdiagnosed as having gastroparesis as a primary diagnosis, which means all that means is your gut is not the food is not moving well through the gut, but it was because of the disruption of his gut flora or microbiota that caused that, right? And, he still, he mentioned he was about 70% better because he finally got with a doc that was actually able to treat that and Carrie will talk about some of the things.
I think when they were going through like what is going on before he found that specialist.
Yeah.
they also thought H. pylori was a potential.
Well, again, H. pylori can cause problems, but it's like anything else. So you have a very delicate balance of its own little ecosystem in there. And when one group starts overgrowing, people may have heard what's called C. difficile or C. diff colitis. That frequently happens after antibiotic use in the hospital to allow this organism called Clostridium difficile to overgrow.
It's necessary.
It's necessary, but not when it overgrows and takes over. And that's called C. difficile colitis. And believe it or not, the most effective treatment for that is a fecal transplant.
Where like my poo in your butt.
That's right. So if I have C. diff, I'll take some of yours to repopulate. It has like a 95% cure rate.
But before they even get there, you have to fail like X number of other antibiotics.
Yeah.
X number of times before they'll just go ahead and treat
You ever
that.
have someone just come and be like, give me the transplant? I got a good donor.
I've had someone that wants a transplant, and I'm like,
Is his name rhyme with Folheim?
no. He's just interested in butt stuff for a whole nother reason. But I have someone that has a dysbiosis, and instead of doing the things that they need to do, they think they need to go get a fecal transplant.
And you got to be careful with that. So here's a case study I'd like to bring up related to that. So remember I talked about how the gut microbiome and the microbiota is its own organ system. It determines energy utilization, not only, training your immune system, it enhances, it supports your metabolism immensely, because that 10 to 30% of food that makes it past the small intestine, the stuff that can't be digested, the microbiota will work on that and extract energy from it in various ways, to the point where someone that is obese has a microbiota that is metabolizing in a very specific way to actually it's interfering with their ability to lose weight. Because what the initial laboratory studies showed, and I probably have talked about this before on the podcast, where there was a group of obese mice and a group of lean mice, and they did a fecal transplant from the lean mice to the obese mice. No other changes, and the obese mice started becoming lean. So what happened recently, there's a case study where someone was being treated for C. difficile colitis with a fecal transplant, but the donor of that transplant was an obese person. And when they did the transplant, this person that is previously fairly lean started to gain weight.
Wow.
So that just shows you how important that is, and how powerful that is, as far as body composition and metabolism. So it's and we're still at the very, 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 very beginning of really understanding this stuff.
Interesting.
Yeah.
Is C. diff deadly?
Yep.
Can be. Yeah.
Yeah. It can cause sepsis. What happens when you have an overgrowth of, like, you've heard of, E. coli overgrowth, some of these, what we call gram-negative bacteria, when you have intestinal permeability and some of these things start getting through to where they shouldn't be, gram-negative bacteria have this thing called lipopolysaccharide. It's part of their cell wall that is actually, it stirs up the immune system. They go like nuclear option. It's hugely inflammatory. And what's interesting, it's being looked at as a cause of a variety of these inflammatory diseases, even diabetes, things like, how many people have a diagnosis of IBS?
Oh, yeah, everyone.
When the doctor's like, oh, we don't know what's going on. We've done colonoscopies and endoscopies. We don't know why you're having diarrhea or constipation, so we're going to call it IBS. Almost always it's a dysbiosis.
But those LPS particles they can set off a cascade of inflammation within the body to the point where if someone doesn't go get treated, they can certainly become septic and die. Yeah. So
Is it like more concerning? I guess when I think of someone having like stomach issues, I think like, okay, maybe like they're fat and like they have a bad diet and like so they're everything's messed up. If someone is like thin, is that maybe more alarming?
I don't think so.
That's just
I don't think so. 'Cause
judgment in my
I have,
head.
yeah, I have both, right? I have an individual where very thin, and they have, excuse me, they have IBS it's determined IBS-C or irritable bowel syndrome, but she has constipation. I have another one, and she's really lean. And then I have another lady that has IBS, and she is overweight, but she has the diarrhea portion. So they're still kind of the same problem. There's still a dysbiosis we have to correct. And the biggest part is getting people to do some buy-in for the treatments that we're doing. We still have people that want like, oh, I'll just take a laxative, or I'll just, I'll take some Imodium to stop the diarrhea. Well, that's not fixing anything. It's fixing the problem in the short run, but it's not fixing the underlying issue. And again, when we get towards the end, we'll talk about what some of those fixes look like.
Yeah, and we talked about antibiotics. We talked about non-steroidal anti-inflammatory use that really dysregulates that the gut microbiota, but also stress itself. Chronic stress will promote intestinal permeability. And then those are the people that will, they're just under a ton of stress. They're having, either constipation or diarrhea or alternating both of them, right? And they are having depression and anxiety. And it kind of feeds into itself, right? Because that's why when we talk about, hey, we got to manage that stress, because if we don't do that, those tight junctions are going to continually be disrupted, and then we're going to keep getting that inflammatory response up the vagus nerve, which causes more flight or fight in the brain, which leads to more stress. You see how this is a vicious cycle? So the education piece is really important, because these people will come into Carrie's clinic and demanding, hey, there must be some food allergy I have. The problem with food allergy testing or food intolerance testing is if you have active intestinal permeability, a food you may not be truly, that may not really be causing a problem under normal circumstances, will then artificially come up positive, because those tight junctions are disrupted and those food particles are getting through to where they shouldn't go. And then that's causing an immune response and a positive on these tests that people do. So really kind of managing the stress, trying to fix the gut, which Carrie's going to talk about, is much more important than trying to, and getting people to buy in like, hey, it might not be this food. This is just probably a false positive. And that's why you don't really use those in your clinic.
I try not to use them for a couple of reasons. One is because it's an out-of-pocket test. I use one that's fairly decent when people do ask for it, but it's still $100 that you have to pay out of pocket just to get these results. I don't like to use it because it wouldn't change what we would really do. And these tests aren't consistent from companies. So I could send your blood work to 3 different labs and potentially come back with 3 different results. So I don't like using them. I do use them occasionally because I do have people where they just need to see that number to make some of the changes that I'm recommending. But I just, we could put that money to use elsewhere more efficiently. But back to the Gordon Ryan case. So he was dropping out of competitions, right? Because he was having such GI.
Well, he just couldn't. He wasn't signing up for him. Yeah, he couldn't compete.
Couldn't compete. I shouldn't say dropping out, but
Right.
he got to a point where he wasn't competing anymore because he couldn't, because that was affecting his athletic performance.
Well, and he's so nauseous that he could barely hang on day to day because of the nausea.
Yeah,
because
supposedly, if he ate anything, essentially.
Well, the food wasn't being transported, right? It's not being pushed through the gut because of the severe dysbiosis he was experiencing. And it's great to hear him kind of returning from such a severe state, but it takes time, right?
It takes a while. This isn't going to happen overnight, which is another reason, modern medicine is amazing. It's great for saving lives. And if we do have an underlying infection that does need an antibiotic, we at least have that for us. However, some of the other things to truly make fixes for some of these things that I think are foundational just take time. And you have to be willing to put in that work. So the athletic performance piece, they found that the gut microbiome overall for athletes is different. And there's an interesting little study that shows that even just the type of exercise that you're doing can cause some changes. So like those people that like to do those HIIT exercises all the time have one type of healthy gut microbiome where some of the ratios are a little bit different versus like endurance athletes versus people that do something more moderate over time. And it's quite different than the sedentary person.
And the thought behind that is, remember how we talked about 10 to 30% of your nutrients will get past the small intestine and make it to the large intestine for the microbiota to work on. And they think that athletes, based on the demands they're placing on their physiology, the gut microbiota is adjusting to help support the host. In other words, extracting more energy. They actually can produce things like amino acids. They produce these molecules called short chain fatty acids that also help with energy and metabolism. So athletes typically will have their microbiome is being used as that second organ to help enhance their performance. Yeah. So you could ask, well, then the exercise itself is doing that, which is true. But if you have these underlying issues like frequent antibiotic use, you're taking a bunch of ibuprofen, all this stuff, and you don't have a healthy microbiome, it absolutely can affect your athletic performance. We're not just talking about endurance athletes. Yeah. We're talking about weightlifters, all across the spectrum. Yeah. So that's why it's really important to get this kind of house in order, not only for your, performance on the mats, but also your overall health.
Yeah. And so there was an interesting little article, a couple little articles that I read. One was talking about the gut microbiome is really kind of essential for helping to maintain muscle mass. And they looked at this mostly in animal models that had cancer. And so often when you have cancer, towards those later stages, like one, you're really not hungry, so the cells still need to feed themselves, so you become cachectic or you start to have muscle wasting. And so when they were able to correct the microbiome of these animals that had cancer, that cachexia went away. They started to build muscle again. So a healthy gut microbiome is essential for maintaining that muscle mass. Also, a research group by Ney, they looked at when they did gut microbiome depletion, again through antibiotic use, that the ability of the muscle to actually contract started to decrease when they didn't have a healthy gut microbiome. So if we think about it from a jiu-jitsu standpoint, if you're trying to be explosive for a takedown or to change position and maybe go, breaking the guard and going to side control or something like that, you need those muscle contractility to be firing like it should in order to make those type of movements.
Interesting.
Yeah.
Okay. Maybe you'll go into this, but how do we keep that?
Yeah.
Make sure that's...
Before we get into correcting things, is there anything else you wanted to add into that athletic performance?
No, that
piece?
was the big thing. Just people think about this thing as an organ system that is necessary. If you optimize this, you can definitely optimize your athletic performance, as we see in these athlete studies. Right. But what Carrie wants to go over is how, let's say you're coming into it and you have a diagnosis of IBS, or you have chronic heartburn, or you have any of these things that are affecting from mouth to anus, as far as the whole tract, that it's really, she has some things to kind of go over that can help rebuild that. And I think that's the biggest take home today.
Yeah. And so just a couple of other examples. they were showing that some endurance athletes, more like those long distance runners, the marathon runners, and then those that do the ultra marathons, they often will have GI issues and respiratory issues. And part of that is how they're feeding themselves. And then they also have some gut dysbiosis. And by correcting that dysbiosis, those infections go down, especially those respiratory infections. There was another piece, but I lost it. So things that we can do to start to correct the GI system.
So before we get there,
Yeah.
we talked a lot about weight cutting recently,
Mm-hmm.
and the method that I used by recommendation from Chris. Do I not have? Because I didn't have any performance issue.
Mm-hmm.
I'd say I felt great. In those short term kind of deals, do we not have to worry about that?
For that, where you were doing more of those readily absorbable carbohydrates,
Mm-hmm.
I don't think so. I think but we haven't done those studies. They're really starting now over the last couple of years to look at gut microbiome and athlete performance.
Yeah.
Long term
Yeah.
use of that stuff,
yeah.
absolutely,
Sure.
because you're providing a substrate or the food that some of these bacteria use to proliferate, this readily digestible carbohydrate.
We're talking a 3-day.
Nah,
Not a big
not
deal.
likely at all.
But the one piece, and I'm glad you brought up the changes in nutrition that I wanted to bring up. So when they looked at people, I think they'll be looking at this in more of our astronaut population, but they, again, through animal studies, put them in kind of a zero gravity kind of area where they weren't getting a lot of exercise. And again, their gut microbiome started to change. So sedentary people not getting a lot of exercise, their gut microbiome is going to look very different than ours. And it's not healthy. It's not a healthy gut
So
microbiome.
there's someone listening that's on the fence about maybe a family member wants to maybe we should start jiu-jitsu or something, or
Some exercise.
some exercise program. It absolutely can start changing it for the better, because your microbiome will adapt to your physiologic demands.
So
too.
what about the people that we all know at least one that tries every diet, Atkins, keto,
That's the problem.
carnivore.
That's the problem, right? Is that one, they're calling them diets and they're trying them for X amount of time, right? So when we're talking about making changes for health, these have to be lifestyle changes. And there's things to me that's just foundational.
Mm-hmm.
You have to exercise routinely. You have to have good nutrition. And you have to have good sleep. All three of those things tie in together, can impact the gut microbiome, and the gut microbiome can impact them as well.
Mm-hmm.
So you got to stop thinking about fucking diets all the time.
Yeah.
You diet to lose weight for cutting,
Uh-huh.
right? Otherwise, we have to do something to change our life. That's what these
those
are.
people that I'm talking about, they'll do, and I get it's difficult when you're making a health lifestyle change.
Right.
But we all know people that will go to whatever the next thing is, but they'll never do it longer than 8 weeks.
Right.
Right?
Right.
Are they almost setting themselves back even further when they're like 3 different diets in? They're now a year plus of
They can be.
no results.
Yeah.
Because that's why they gave up, right?
They can be. They can be starting to do some good things.
Mm-hmm.
And this was, again, part of that podcast that you and I listened to yesterday, where they were going through these different nutritional styles. We should call them nutritional styles and not diets, because they have different health benefits and food densities and nutrient densities. And that that really should be a different podcast altogether. But you're starting to set yourself up to make a healthy change, and then you change to something else, and now that goes. So that gravity study where they looked at sedentary lifestyle, the gut microbiome started to change in 5 days. So if we're not sticking with something for a while as far as changing our health, you're not going to see results. You're just not.
Exactly. And you got to think about that whole allostatic load, the stress cup we talked about at the, one of the very beginning episodes, where regardless of the source, that can impact the gut dramatically if you're overdoing it. Whether you're poor sleep, you're just have a lot of social, psychological stress, poor diet, all that will impact that. And to your question directly, it takes time to right that ship. You look at, I think Gordon Ryan said he'd been working on this for the better part of a year now, right?
Oh, with the new
thing,
doctor.
and it's finally starting to work, but it takes time to have that repopulate, grow, and start to adapt to the physiologic demands he wants to place on it, right? So you think of it as building up an organ system again.
Yeah.
So that consistency is very important. And what I hope Carrie's going to talk about soon is what would be the baseline to get that started. So what are some things to do to kind of help stop the intestinal permeability a bit and get some inflammation calmed down and then start kind of rebuilding it?
Yeah. So we always need to start with nutritional changes, right? And for some people, we have to do some baby steps. Like we have to, let's say we do a 2-week food log, and let's say they're eating a lot of dairy. Well, maybe that dairy is causing issues for them. So we have them cut that out. And you have to cut it out for a minimum of 8 weeks. These 2-week little, cut this out for 2 weeks and then put it back in. And they're like, well, I didn't notice anything, so it's good. Well, you didn't do it long enough. It takes the GI system a little bit longer to get things caught up. So for my patients, we start with some sort of nutritional change. Kind of hard to get them to eat, just like proteins, vegetables, and healthy fats sometimes.
Yeah.
And again, with nutritional changes, like if it's date night, like after jiu-jitsu, we had a pizza, right? But that's not how we eat every day. 80% of the time, you should be eating fairly cleanly. The other 20%, go have a beer, go have the pizza, go have the burger or the
Ice cream.
Is it ice cream, Dairy Queen. And so that's fine. As long as you're setting yourself up for success, those small indiscretions are not going to be a problem. If it's something like they have chronic heartburn, well, I'm going to put in something that has like some glutamine, some slippery elm, some marshmallow root, things to really kind of help heal that GI system. And then the big thing, and this is where I get a lot of pushback on people, but thankfully there's a supplement out there, is to get that prebiotic, probiotic combo with fermented fibrous foods. So things like kimchi, sauerkraut, fermented beets, fermented carrots, because you're getting the prebiotic from the fermentation. You're getting the probiotic from the fermentation, the prebiotic from those fibers that aren't going to be necessarily digested completely in the stomach or the small intestines, and can go down to the large intestines where that preponderance of the gut microbiome is, and they can start to break that down into those short chain fatty acids, more specifically things like butyrate. Butyrate is the preferred fuel for the preferred gut microbiome population, also the preferred fuel for the cells of the intestines so that they can heal. So now I get it. People don't like that vinegary taste. Well, that's fine. Then use some butyrate. People get into problems with using butyrate as a supplement by itself because they look at the label. It says, "Oh, I need to take 8 of these." So they take all 8, and then they feel all gassy and bloated and uncomfortable. Well,
like a foamy latte.
You have to start slow and work your way up and build this up. They're showing. So was it last year? I believe it was last year. I did a little event with Dr. William Seeds for the Alzheimer's Foundation, and I had the good fortune to talk all about butyrate. And so things that butyrate does, it can help with weight loss. It can help it actually is one of those molecules that will travel up to the travel up to the brain, past that blood-brain barrier, and can help with things like dementia, Alzheimer's, Parkinson's disease. And so it is a great little supplement, but you got to be careful with it. You know, supplements aren't just these benign little things that you can take and everything's all good.
It's good that you're speaking at like events like that, because you're in that unique position of studying the gut so much, and then also living with someone that has deep onset Alzheimer's, dementia.
Well, we did put the bench out there for the duck feeding.
Yeah,
that's his happy place.
So it's like you get to like really educate a whole community, whether they're going to remember or not.
Yeah. But we're educating the caregivers.
That's true.
Yeah,
that's
so
true.
They can take care of them.
They're there for a good time.
Yeah.
And the hors d'oeuvres.
Yeah, exactly.
And I just want to commend you on serving in that way, because you've been dealt a tough hand. I
chose it though, and I would happily choose it again.
You are the Notebook, just in reverse.
Wait, what's going on here? Where am I?
What are these grapes doing here?
So that's just foundational. Gut health doesn't have to be super complicated. Eating good foods, and if you don't like some of those foods, then there's a way around it with supplements. But again, we have to be careful with supplements. And then probably one of the questions will be, well, I take probiotics all the time. And there's some studies out that are showing that probiotics can be helpful, but they're still kind of on the fence with that. And I think the problem with that is because they're only looking at it in a short time window. Like they looked at it at 4 weeks. And they're like, oh, they're kind of helpful. When it really needs to be a much longer term study. And they need to think about the probiotics that they're actually taking. So when we think about probiotics, they come in this nice little bottle. They're sitting on the shelf. God only knows how long they've been sitting in the Amazon warehouse, the temperature of that Amazon warehouse. So how many microbes are actually still viable, and then they still have to get through that harsh acidic environment of the stomach to get to where they need to go. So for me, doing something more like foods and butyrate is a better way to influence that gut microbiome than just trying with probiotics.
We do have a question at the end that actually pertains to pro and prebiotics.
Oh, perfect. Let's save that, because I was going to comment on that. We'll save it for that question. Okay.
But I mean, my protocol is pretty simple. So I think it's for the most part has been successful. I have a few people that really aren't leaning into that butyrate portion, but we'll get there.
It's interesting though. But if you have a patient like that, you're trying to fix their gut, but they're a stress ball and they're sleeping terribly. It's almost like it's a losing battle, right? Because they're constantly having intestinal permeability through the stress, right? And getting them to buy in, like you've got to do something about that, whether mindfulness meditation, different types of exercise, acupuncture, things like that are really, really important. And getting that sleep under control, which we talked about in that previous episode. All kind of relates together, right?
It sure does. It sure does.
Is that when you're starting to diagnose and deal with someone that's having gut issues, and it's very apparent that the sleep, and they are self-admittingly, maybe you don't have to help them realize that they are stressed constantly. Is that what you're going to tackle first?
It depends on how much they can handle, right? So if there's someone that's super motivated, then we'll work on sleep and gut health, and hopefully that'll calm their anxiety down. If they can only handle a little bit, we're going to correct sleep first, and then we're going to work on their anxiety, and then we'll start to get their gut health under control.
That snowballs usually in the right direction when you start doing that. I mean, that's the value of having an appointment with a physician like Carrie, who can spend the hour at a time and talk about your sleep, talk about your stress, talk about this stuff, as opposed to coming in, I have heartburn or I have diarrhea all the time. Like, here's some Imodium, and why? He never asked about the sleep, stress, all these things that are driving these underlying processes, right? And I think that's the problem with the current medical model right now.
Right.
I still think in general that physicians that are in more corporate medicine, they'd like to do something different. They just can't.
They absolutely would.
But there are some, and they're just kind of set in their ways, and they're not going to change, and they don't want to learn anything new. They just want to know about the latest medication or the latest procedure when they're not covering some of the foundations. And so I think the foundations are important.
Yeah. So I think we're just going into prevention.
Well, we've already kind of talked about treatment and prevention.
The biggest things you can do, so dealing with sleep and stress, okay, both are bad sleep, and which is a stress, will impact that intestinal permeability and cause that inflammatory response, lead to dysbiosis as well. Frequent non-steroidal anti-inflammatory use, really watch how often you're popping those ibuprofen, especially if you're taking them all the time. Chronic use of proton pump inhibitors, where you're just using, because there's other things you can do for that, which Carrie could talk about at length. And then the frequent antibiotic use. Yes, there's a time and place for antibiotics, but not every time you have a cold, think you need an antibiotic. Most of it's viral. And those are the big preventive things that you can do for sure.
Yeah.
Okay.
Was there anything else you wanted to add as far as treatments?
No, not right now.
Okay.
No, I don't think so.
What you got for us?
Questions?
Yeah.
Well, Liv, if you want to throw that light on for you. I know we had a couple different questions come in. We could probably start with the, because we just kind of talked about it, the probiotic / prebiotic. And I believe Olivia has that question for us.
I do.
Did we wake you, Liv?
Yeah. I just sleep back
Yeah,
here.
just a little nappy poo.
Yeah.
Okay.
Got Frank back there.
Wrong one. Okay. So you want me to just start with the
Yeah.
probiotic?
Yeah. You preface it.
I'm just going to read what this
Okay.
said.
Yeah.
Okay. So what's the difference between prebiotics and probiotics? That's the first question. And then should you be doing both of them, and in what form? Which you guys kind of answered.
So
but
I'll tackle the first part. I definitely want Carrie's expertise in what form. Okay. So prebiotic is, you can think of it as the fuel that the bacteria or microorganisms in your large intestine are going to use basically to eat. And then when they do that, not only does it enhance the growth of these quote unquote, or creates good diversity of the species, but their byproduct or quote unquote waste product is butyrate. So they ferment these things. They're things that we can't digest naturally, these fibers, different types of fiber. That's what prebiotics almost always are. The bacteria or microorganisms use that as fuel, and they promote their waste product is butyrate or propionate or one of these short chain fatty acids that our colon uses. So it's a very good symbiotic relationship where we're feeding them something and they're giving us something in return. That's the prebiotic, and it helps maintain growth and diversity of the microbiota. A probiotic is an actual organism itself, like in yogurt, lactobacillus, bifidobacterium. There's many different types of species. And when you look at, like, if you buy a probiotic, it says 10 species or whatever, right? It'll list which ones are on there. The interesting thing about that is it doesn't seem they really repopulate your gut. What it seems like they do is they pass through, and on the way through, transiting, they have a beneficial effect with the immune system, is what we're thinking, how they actually work. And that's why people take them all the time, because you're getting them daily, and the immune system's getting kind of a signal like, hey, these things are passing through, and They think that's how they're promoting their effects. The prebiotics are really is what's going to help the regrowth and the repopulation. So that's the difference. And then the other question was,
Like, should you do both of them?
yeah. So I always recommend doing both, and I think Carrie does too. And the way I do them is like from kimchi, because kimchi basically is a fermented food. In other words, you have the vegetables in there that are fermented, that you already have a microorganism acting on them, right? And it helps outcompete other microorganisms that may degrade them. So that's why you can store fermented vegetables for a long time without them quote unquote spoiling. So with fermented foods like sauerkraut and kimchi and things like that, kefir, whatever you can have fermented dairy if you tolerate dairy well.
Like kefir, that's the same thing.
I think it's called kefir.
Is it?
My son-in-law is Russian, and he says it's kefir. You can ask Nikita too.
Interesting.
Yeah, if you go kefir, you sound like you're down. You know, you have a
do
little
that?
bit of kefir.
Well, okay, so my mom would call it kefir, but then Dr. what's his name? Saladino? I think he calls it kefir. So I was like, oh, okay.
I think you would have to ask some.
I got a good kefir story.
I bet you do.
So,
Oh, okay. You're just going right into it.
yep, the down in the country when we used to live down there, we or family members lived down there. They made their own kefir.
Yep.
Well, I don't think it was kefir. I think it was just goat's milk.
Oh, really?
Yeah.
Same. So
Not really.
You got to ferment it to.
They-
I mean, they did make their own kefir, but yes.
it was amazing
kefir.
because this family member had goats, and they would use the goat milk, and I remember they were so stoked and happy about the goat's milk. They really liked it, which was good.
Yeah.
But they also had one male goat, and I remember they were trying. I stick to my things. I don't I get one flavor all the time. I get one kind of candy bar. I have my go-tos, and I don't stray. So when someone's trying to give me some goat milk, I'm like, if unless it's regular milk, I'm not going to drink it. So they start talking me into it. And they're like, well, let me just, it's a fresh batch. So they take a swig just to get a little taste, make sure it's good. And they just go, you know what? It tastes a little bucky. And I was like, I'm sorry, what? What does that mean? She's like, like the females are around the male because a male is called a buck. Mm-hmm. And then they go in for another swig, smacking their lips, and little bucky. You could tell. I'm like, what does that mean though? When it tastes bucky, that means bad things, gross things, and they just kept drinking it.
If they were used to it, they're okay. They're kind of inoculated.
I'm a city boy.
Yeah.
And I want that thing to go through about 14 baths.
Of pasteurization.
The problem is you just ruined everything, though.
Yeah.
You ruined everything.
You just basically took a good, healthy food and destroyed it.
Well, now because you're talking trash, I'm not going to put pants on.
Why start today?
Yeah. I thought that was because it was kefir. It was just because it was goat's milk?
Yeah.
That's funny.
So the kefir is then you can get it with goat's milk. You can do cow's milk. It's fermented with a microorganism that starts that fermentation process. So you're getting the microorganism with the food itself.
Okay.
So that is a pre and probiotic.
I got a question.
Yep.
So with sauerkraut, kimchi, stuff like that, how much should someone take in a day to support?
You will know because I've overdone it a couple times and it gets a little loose.
I tend to recommend people start off with like a quarter a cup a day.
Yeah.
And then if they can tolerate more, they can build up.
Otherwise, you get towards that 6-7 on the scale.
Oh, yeah.
Okay.
Yeah.
A little cow patty looking.
Hey, confetti butt.
Yeah. So, but yeah, and start to, as with anything new, start slowly.
But you guys have said also, and don't entirely remember, but there's multiple probiotics. Like if you just do kimchi, like that's only hitting one strain or something like that.
But it's getting that prebiotic fiber, which is really much more beneficial for helping to grow a nice, healthy gut microbiome.
Because remember, the dietary probiotic that you're taking doesn't really repopulate the gut.
Okay.
It just kind of passes through and
Yeah.
has some beneficial effects, but the prebiotic is really helping the regrowth.
Okay.
Yep.
So you said you were going to answer a couple pieces of that question, and you've had enough airtime, and you said Carrie was going to answer the other part. What part was
But I
that?
think he kind of answered that.
He
in what
did kind of
form.
answer it. So
What
I
form?
actually-
You said what
Of
form?
shit.
Right. But I mean, the fermented fibrous foods is the best if we're going to do something that's both a pre and a probiotic. If you don't like those foods, getting that butyrate, which is that breakdown product of those fermented foods that the gut microbiome would make, is a good second choice.
Any brand or anything that you recommend? Or
I do have a brand that I recommend to my patient. It's called Body Bio because they do really good third-party testing. And then also the probiotic, those can get really expensive. And I actually saw when we were getting information for today that they were recommending the sachets, which I think that's... I haven't used that company in a long time. I'll have to think about it. I don't know why they recommend the sachets over the capsules. Maybe because they're refrigerated and they tend to last longer. So I would get a refrigerated probiotic.
okay. More questions?
Yeah.
Oh, real quick.
Oh yeah.
Yogurt in general is not the best. The stuff you get commercially typically is just a pile of sugar.
Okay. This person mentioned we had
You-
someone mention yogurt.
Now, I'm just saying, in general, the stuff you buy at the supermarket, look at the labels. You might as well be eating ice cream.
Okay.
Okay, and the amount of active culture in there varies tremendously.
Okay.
So that's a public service announcement.
You guys kind of answered this, but it was where do we get our good bacteria for our gut? And then, yes, there's yogurt and fermentable food, but where else is it coming from? Is that it?
I mean, that was the yogurt.
Yeah, and
Reference.
and soils. People. I'm not saying you shouldn't wash your food, but the degree that people go now, like when you go to a farmer's market and get stuff, the degree that people scrub and try to make things sterile, it's not doing them any favors. You still get a lot of that on there. That your especially as when you're developing your microbiome as a child, it's super important. You don't have these parents running around trying to
So what were they doing like 1,000 years ago?
Exactly.
Like
Is what they were doing.
Was it they were probably still eating fermented foods?
Well, not only but they were also living out in the environment typically.
Right.
You're getting these, you don't have this pristine, sterilized food, right?
Mm-hmm.
And so, especially kids are getting a lot of their developing microbiome from there. And they've actually done studies looking at children from very industrialized, urban areas versus more rural, and their microbiomes are incredibly different, where you have a less diverse microbiota in this kind of the city dweller, and a much more diverse and more health associated in the kind of rural type of upbringing. And I can't say that enough. So these parents trying to protect their kid from and there's a lot of quote unquote germaphobes around, and we really need to start rethinking a lot of that.
I mean, you'd probably start seeing, oddly, the people that are germaphobes just will get sick more often. Just
It's not odd.
Yeah.
It's predictable.
yeah.
It's very predictable because they're not tuning their immune system. They probably grew up like that, where we're just I'm not saying be disgusting and go use good hygiene, but
Don't shit in an egg carton.
But exactly. So it's super, super important for our health. And, we have to start treating this and really trying to build it up correctly. And, they're asking where this stuff comes from. all these things Carrie was talking about, vaginal birth,
Nursing.
nursing, playing in the dirt as kids, our food.
Okay.
Yep.
Besides an EGD or a colonoscopy, is there any other tests you should be doing for gut health time and again? Is there any blood tests that can tell you the health of your gut?
Well, we're back to starting really simple. Just look at your poo. What does it look like?
Mm-hmm.
If we have sausages, you're pretty okay. If we have milk duds or payday bars, or if we have cow pies or confetti butt, you got an issue.
What about color?
Oh, that's a good question.
I personally don't see color, but
You should see brown.
okay,
You should see brown.
green.
So it depends, right? So those other colors of stool, what's bad is if your stool looks like tar. You need to go to the ER.
Like a black,
Yep, because there's
a
some
bleed somewhere.
bleed coming somewhere.
like deep in
Yep.
the intestine.
Yep.
It looks like tar.
Yeah.
Yeah, it's that kind of color.
But most stool is typically some shade of brown.
You could have some bile acid dysfunction and things like that if you have these very, very pale looking
Yeah.
things too from time to time. But
Paley yellow or something.
yeah, it will, but it will change. It will vary depending on what you're eating too, and especially depending on if you're eating, like, for instance, if you're eating lots of curcumin or turmeric or something like that,
It'll be a little more orangey.
it'll be a little orangey looking.
Or the beets. Your stool will be a little bit more red.
What is green?
Green is that gallbladder
Yeah,
up higher issue.
Inflammation.
Could be,
Not necessarily
vegetables too, right?
Vegetables.
not typically, not green. Green's a little odd.
Yeah. But regular testing, you shouldn't need to do regular testing. And again, some of those stool tests, they are so fucking expensive. It's ridiculous. And again, it's not necessarily going to change what we do. So I've had people like, I just went ahead and did this stool test. It cost them like $350. And what was the recommendation on there? Butyrate.
The same thing you were going to recommend anyway.
Exactly. So, start by looking at, honestly, look at what your stools look
Now,
like.
you have, like, if you suspect small intestinal bacterial overgrowth or like a candida overgrowth or something like that, there are some, like you said, the breath tests
The
and
breath
stuff.
test can be helpful. The candida, you would have to get a stool sample. And again, we're back pooping into the Cool Whip container and sending that off to the lab. But we would have indications for that. We would have some sort of symptoms showing up for that. And then it's still like we have these processes to help reestablish that first.
I actually have a question. You were talking about zonulin. What does that have to do with gluten? Because I always feel like I hear it with gluten.
Exactly. Because gluten in a susceptible population, especially celiac, that's part of the process of intestinal permeability and involves that zonulin cascade. So gluten is actually triggering that intestinal permeability, and then it gets to the immune system. Those big glutenins and gliadins, they go through places they're not supposed to get through, and they basically, those that are genetically predisposed to celiac, you'll actually have an autoimmune attack on your actual intestinal barrier. Yep, that's what's called celiac disease. So that is, celiac disease is kind of the prototypical study disease when, guys like Alessio Fasano from University of Maryland, who's one of the top research gastroenterologists, did a ton of early research on using that as a model, looking at the whole intestinal permeability, which involves zonulin. That's why you see that all the time. It was one of the kind of the disease everyone studies for this type of thing.
Interesting. Is that all the questions?
At least on my side for now.
You guys got anything else?
Yep, check your poo.
Check your poo.
Check your poo. Seems like that's the big thing. I mean, colonoscopy every 5 years.
Oh, you don't have any questions, Bill?
I don't have any.
Oh.
Colonoscopy every 5 years.
So
recommended?
colonoscopy, it depends, right?
Ooh.
So let's say that Chris's father or mother had colon cancer in their 30s,
Mm-hmm.
let's say 30, he would need a colonoscopy at 25. So typically colonoscopies start at the age of 50, but it depends. And then if you're otherwise healthy, you could probably get away with something called a Cologuard test. Again, we're pooping into a container and sending it off somewhere. And they're looking for DNA markers that are consistent with cancer. And that's done every 3 years. Some colonoscopies are every 5 years. Some are every 10 years, depending upon the GI specialist.
Exactly. Typically for age 50 is when they recommend screening, unless you have a family history. But there's, plenty of research showing butyrate is protective against colon cancer formation.
Nice. Nerd alert. Okay. Well, I think it was super informational. A lot to chew on this one. If anybody has questions, grappling with podcast at Gmail? Yes. At gmail.com.
Little dementia?
A little dementia. It's rubbing off on me. Okay. Breathing the same air as this guy.
Okay. Stop playing with his poo.
Yeah. Well, I can't because it's nice.
Okay.
Oh my gosh, you're so gross.
Easy over there.
You're gross.
Well, you signed the dotted line.
Yeah.
Like I said, I'm not going to put pants on, but it was a good conversation, people.
Okay.
Hit it, Liv.
Awesome.
Thanks, y'all.
Oh, you guys are retarded.